been tough for you, being at home and being locked down? And
we've been virtually locked down. My wife has managed to get out occasionally to the local shop.
I mean, just simple words there, reacting it. You're quite emotional by that.
Well, it's just, it's been such a tough year for so many people, and there's William Shakespeare putting it so simply for everybody that, we can get on with our lives.
Medication time, medication time, medication time, medication time, medication time, medication time, medication time.
My profession is being destroyed, really, because people are pretending that it's led by the science and following the evidence when it's clear we're doing no such thing. Every time there was a chance to have stepped down with grace and to say, the worst has now passed, or, we don't anticipate, a return to the conditions of spring. Every single time they've played fear, fear, fear card. I think they're extremely badly advised by a group of individuals who might have been great for, responding to a nuclear contamination threat, but they're just hopeless where it comes to the spread of an infectious disease, the building of immunity by populations, and then also just looking at how many people have been infected versus how many have actually died, and just failing to do simple maths, which would tell you that this is now already very close to the lethality and public health threat of a rather unpleasant seasonal flu. But instead, they're pretending that almost everybody is still vulnerable. Everybody's got a lockdown, and ignoring the consequences of their quotes measures, and basically allowing more people to die as a consequence of the measures than they could possibly have saved, even if any of their measures had been successful. And I also just don't see a way out of it. And then finally, maybe we'll come on to this, my present fear is that development of vaccines are being accelerated for political reasons mostly rather than medical reasons, and that biggest fear is that we're going to end up in a situation with something like mandated or coerced forced vaccination of the population, and having to carry around health and vaccination status tokens on our phones, because I swear cleverer people than me think this would be a disaster, because it would never be unwound. That would represent a permanent transition of your control of your health and access to everything being at the behest of whoever has the database and the underlying systems. If you Google Ofcom coronavirus broadcasting guidelines, prepare to be shocked. When I read it, effectively it said it cautions radio, TV broadcasters and all print media that such is the health emergency in this country related because of coronavirus, that we're telling you're going to have to be really careful about what views you give airtime, oxygen, and publicity to. And if you have anyone on that is talking in a way that's in contradiction to either government statements or those of their authorized health advisors, you could potentially be in breach of these guidelines and could be fined or lose your license. And the more you read that, the more you think, actually, I think it's not too far a bigger point to say, in this regard, the coronavirus, you've got a freer press in Russia than in UK. I've written to and contacted every major newspaper, radio channel and TV. Only one of them got back to me. It was Piers Morgan, because he hates the government. And of course, I didn't take him off on his kind offer. But no one else. And I'm a professional scientist. I've published 60 peer-reviewed papers. I've run companies. I'm not a deliberate idiot. And I sincerely believe the government has made, at best, inverted commas, lots of mistakes. And I'm not even allowed to share this. I have to go to, I think this is great. I'm enjoying doing podcasts. I have to do podcasts, lock down skeptics, or go on Twitter. And that's the only way I can get my message out. And of course, I've got 0.0001% of the share of voice of the official media. So that also makes me angry. That it's really difficult to get. You don't get a balanced opinion. That's why it's like a terror story all year. It's because the main media have taken a sort of editorial view, or they may be being guided by their in-house lawyers, that we better stick to the party line or Ofcom will break our fingers. That's really terrible. It's not for me to have to pull out a correct motivation in order to know that something is wrong. So I don't know why they're doing what they're doing, but in lots of ways they're wrong. I've mentioned this initial susceptibility being 100%, and of course the reality was probably less than 70%. But here's another one that follows from that when I realized this is what they were, someone from Sage had told me this opinion, And I thought, my God, it's not just a line. They actually believe it. That's the official position that Boris Johnson and Matthew Hancock are being given. And so no wonder these people who are probably classics graduates or PPE or whatever, they're not STEM subject graduates. They're not, they're adequately numerate. I'm sure they can work out their bank accounts, but they're not the masters of very large numbers, very small numbers, probability, conditional probability, and the like. And why should they be? But if they get told by their lead scientists that actually most of the population of your country, you're in charge, are at risk of catching this, and maybe 1% of them dying. So, you've got to keep them wearing masks, socially distancing, washing their hands, not going to work. And so if that, I believe, is what SAGE thinks. They don't all think that. I know Sir Pat Vallance is far too clever to believe that. But the bulk of the people who are not immunologists, who are not epidemiologists, but they're modelers, or psychologists or whatever, that's what they've heard, and so that's the message they'll take, and you'll hear it on the TV. But so that means that they think we're only about 1/15 of the way through this. And so unless someone can persuade them otherwise, I don't think the British government is going to ever get advice to do anything other than what we're doing. They'll also logically think, since we're so many of us still at risk of catching it and dying, that of course it makes sense, regrettably, to have to force us to take the vaccine because we'll benefit from it. And of course, neither of those statements are true. We could lift all the measures today, respectfully, be careful with people who feel vulnerable or are actually vulnerable. They're smart enough to know how to handle themselves. They've got through every winter where we have flu every year. So, but everybody else could just carry on. So one of my contrast points between what do I think SAGE believes and what does the reality suggest, and it's the interpretation of Sweden. I think SAGE, denial. You won't get anybody seriously discussing it. And people who are not on SAGE will say things like, well, you can't possibly compare Sweden to UK. And I think, well, why not? The reason I say you should is if you can be bothered to look at Our World in Data, owid.com, you can get all the data, throw up the curves, the daily deaths normalized for population, so like deaths per 100,000 people, and then do the same for Sweden and UK, and you'll find that the curves are almost superimposable. And you can see the pandemic passes through their population and ours exactly the same, to the same day. Actually, you can see the shape and the curve, and they've had exactly the same lethality. 0.06% of their population have died. So same as ours. It ought to be a political scandal. I just don't understand why more doctors in the NHS haven't come out. I know I couldn't live with myself. If I was a physician in the NHS and I had the insights I had, I would have to speak about it. And I want you in the NHS. If you believe what I've told you is even roughly right, you need to do something. When they tell us how many people died of COVID in the last 24 hours, we have now tested 20 million people in the country, which is almost a third. Now, some of those people just will randomly die. 620,000 people a year die in this country. And so that means, it's tens of, it's whatever, it's several tens of thousands a month. And so once you've tested a third of the population, given that, the virus, if ever present, can be detected for up to, we think, at least 10 weeks, you start to do the numbers on the numbers, and it's not surprising that a small proportion of people who die have had a positive test in the prior 28 days. And so there is a proportion of false COVID deaths in the statistics. I think they will find out who they are later when they do provided detailed medical notes were kept. Coroners in the future will look back on this and be shaking their heads about how the hell did they conclude this was a COVID death? Well, it's because we've decided to call it that if you die of any cause and were positive in this PCR test in the prior 28 days. There is out there on the web someone who's plotted a graph on the one axis of the aggregate number of deaths of influenza for the last 2 winters on the one axis, and then the number of deaths from COVID on the other axis, and it's perfectly inversely correlated. So if you had lots of deaths in the last 2 winters from flu, you had very few deaths from COVID this year, and Germany and Greece are down there on the bottom right-hand side. If on the other hand you had mild deaths from flu in the last 2 years, you've had a horrible time this year. Top left, Italy, Belgium, UK, Sweden a bit further down. So it's not the whole explanation, but most of the explanation has got absolutely nothing to do with government intervention. Trashed economies, you've killed small businesses that several generations of hardworking people have spent their multiple lives building. and now they're destroyed. And some people will have killed themselves and others will yet do it. And all for nothing, all to defend the arses of our politicians and useless scientific advisors who should be absolutely ashamed of themselves.